Hi, this is pharmacist Curtis Alexander. In this video, we're going to be talking about the medication called Mavyret. Before we get into that real quick, if you enjoy the video, I'd appreciate a thumbs up. Also subscribe. Make sure you subscribe if you want to see more videos like this on medications and supplements. So Mavyret, its use is for hepatitis C. So it's a fairly rare drug, but when it's seen, it's kind of an interesting drug. Now, as far as how it works to treat hepatitis C, its mechanism of action is it's basically going in and it's blocking hepatitis C replication from reproducing. And it does that. Actually, Mavyret is a combination of two separate medications in one pill. Now, the thing that can be problematic, obviously hepatitis C is a problematic disease to start with. But one of the things when you give a patient who has hepatitis C Mavyret, what we can see happen is that it can actually reactivate hepatitis B, as in boy. So before we start somebody on Mavyret, one of the first things your doctor is going to need to do is measure your blood to see if you have any hepatitis B. If you don't, that's a good sign that we can move forward. The other thing, before we start Mavyret, they're going to test you for what's called a Child-Pugh score. And usually if you're being put on Mavyret, you're seeing a gastroenterologist usually who prescribes this. But the Child-Pugh is basically a stratification, a scoring system to let us know that you're okay to take Mavyret. Now, the score has to be low enough. If your score gets too high with the Child-Pugh, it's contraindicated. You can't take Mavyret. So the things they're going to be looking at is your labs. They'll look at your INR, which is to tell you how fast your blood clots. The other thing that we'll look at is they'll do a physical on you to see if you have what's called ascites, and you'll usually see that if your stomach is distended just from the liver problems that are going on. So Child-Pugh score, the hepatitis B, also the thing to keep in mind, something if you're on Mavyret that you want to keep an eye on. If you're diabetic, Mavyret can actually cause, this sounds good, but it can cause problems with Mavyret. It can actually cause you to metabolize glucose more efficiently, and that can show up with some blood, some blood glucose problems. So that's something that you definitely want to keep an eye out for. So keep an eye out for some hypoglycemia. Next, the dosing. Mavyret comes in a box of 84 doses, and that's 3 of those a day. So one box lasts 28 days. The course is for 8 weeks, and you do want to take that with food. So once the 8 weeks is done, the course of Mavyret is also done. Now, side effects. I try to list, generally just the 5 most common with Mavyret. It tends to revolve around stomach side effects. So one of the more common ones is going to be nausea. That's 6 to 12% of people. You can see a little bit of fatigue, 8 to 15% of people. Then we have HA, which is headache, 6 to 17% of people. You can see rash in some users, and again another GI, gastrointestinal, which is diarrhea, and 3 to 7% of people. Mavyret does have drug interactions, but it's really hard to stratify them. So your best bet is if you're being put on Mavyret, you want to be talking with your pharmacy. You'll be getting Mavyret from a specialty pharmacy, but they need to know the other medications that you're on to run a check specifically for your situation. The other part about Mavyret that can be problematic is the cost. The good news is most insurances pay for Mavyret. There's usually a prior authorization process that they have to go through, but in most cases it's actually affordable once it goes through that process. But it can be, you may have to overcome some hurdles to get to that process, but most of the time they pay for it. I'm going to include a link in the description. They do have some financial assistance, that kind of thing, through the drug companies. So again, this is Mavyret for hepatitis C. Curtis Alexander, I'm a pharmacist. Any questions, post them in the comments. I'll do my best to answer those. And until the next video, thank you.